Hi, this is Stephanie with Empower Physical Therapy. I thought I'd talk about my blog post today on if you've had back pain and it keeps on returning, it's because your doctors may not have told you about this. So often we get into this merry-go-round of treatments. We have back pain, it kind of goes away on its own, which is really common, and then it comes back, and as it comes back, it gets worse and worse and worse. And then you get to the point where you're just fearful that you're not going to be able to move, or you're not going to be able to go to work, or you're not coming home spending time with your family because you're exhausted. It's really common. We go to the doctor, and a lot of times the doctor may end up sending you to pain management, and then you're down the road of taking medications or injections, or worse, they decide to go down the surgery route. And then it kind of comes back again. And it's really common because we've got to get down to the source of what you are doing throughout the day and no one really gives people education around that. And so a lot of times when people have back pain, it just comes, like they aren't sure what they did. And because they aren't sure what they did, we've got to figure out what you are doing throughout the day that's creating it, adjust some of those things, and really give you education as to what's going on and how we can progress you to getting back to the things that you love to do. And so often medical providers don't do this. We go into wanting to do injections and medications, which only treat the chemical side of things. And the chemical side of things is just, that's it. You have an injury, the chemicals come in, and we treat chemicals with chemicals. But if there's a mechanical side of things, which is really often the case with back pain, then we've got to treat the mechanics. And how do we know that? You can ask questions like, can you make your pain come and go? Can you move into different positions that make your pain better or worse? Those are mechanical things that we need to address, and that's so often not addressed with some other medical providers, doctors, those kind of things, and that's what we do. I have my 5 tips report. It's my 5 best tips that I give my patients that have low back pain, and you can go and click on this and get to that resource of those 5 tips that really are things that I talk to my patients all the time that have back pain to really help them overcome this. So if you want some of that education, feel free to reach out. Empower Physical Therapy, you can get onto my website to get it, or you can just click below. I hope this education was great. Thanks for listening.